Hi everyone, I'm Dr. Goodman from Evendale-Blue Pet Hospital, and I'm here today to answer some questions about when we would recommend lab work on your cats that are part of your family at home. So I'm here today with my practice manager, Jen, and she's going to ask me some of those questions. Jen, what is your first question that you'd like to know about cats and recommending blood work?
So when would you recommend lab work for my cat?
So you come into our office with your fur baby, and I'm going to recommend doing lab work or blood work on your kiddo yearly, as well as any time that they're sick.
So I hear people at the veterinary hospital say baseline blood work a lot. What is baseline blood work?
Baseline blood work, I can't stress enough, is truly one of the most important things we can do for our kiddos. It is something where we used to recommend blood work only on animals when they were over the age of 7 because they were considered seniors, but research has actually shown when we start running blood work at the age of 1, we uncover in about 2 out of 10 cats will actually have underlying problems that we can stay ahead of and actually intervene early to prevent the onset of a disease process. And so this is why we recommend blood work, because with trends, we can watch your cat and their lab work and see, are those kidney enzymes slowly creeping up? And even if they're in the normal range, that's not normal for your kiddo at home. That's something that's wrong.
So does blood work actually provide a diagnosis for my cat?
Blood work can definitely provide a diagnosis for some things, but also it doesn't necessarily provide a diagnosis for other things, such as we can have an animal come in and they can have elevated white blood cells, but they're acting completely healthy and we're not sure where we're getting the elevation from, or is it from inflammation somewhere in the body. But many times it does provide us a pathway that will help us lead to finding a diagnosis for what is going on with your kiddo.
What about cancer? Will a blood test detect cat cancer?
Some cancers, yes, some cancers, no. And this is why cancer is nasty and horrible and we all hate it. There are certain cancers that actually will have markers in blood work that will let us know that your fur baby has maybe, unfortunately, a lymphoma, or the calcium will be elevated. But there are a lot of blood works that are normal in an older animal or a younger cat that it's normal, but yet we still have weight loss and we might not have an answer and there still might be cancer there.
How effective are the lab tests that we run in cats?
Again, I think this goes back to our trends. The lab work is very effective. It's very effective in monitoring their trends every year and watching to see what, let's say for thyroid disease. Thyroid is a test where we see a value once a year on our older cats, but it might still be in the normal range, but it's still creeping up and we have a little bit of weight loss, and medicine changes every day. And so when we see that marker, we actually know that your cat is developing hyperthyroidism, and that allows us to intervene and step in and help actually get the proper treatment that your cat needs.
So I hear veterinarians say lab tests, blood work, things like that. What type of lab tests do veterinarians actually use?
It actually depends on the situation. So if you're a young, healthy cat coming in for an annual preventative exam, then we're going to run a panel that's a young preventative panel, and it's going to include white and red blood cells and platelets, which is your CBC. It's going to include a short chemistry screen that's going to look at your liver and your kidney function, your electrolytes, and it's also going to include a leukemia FIV heartworm test. If you're a sick animal coming in and you're vomiting and you're losing weight or you're having problems, we're going to run a sick panel, which is going to be a more comprehensive panel that's going to include everything that I just said. But if you're vomiting, we're going to add on a pancreatitis test maybe, or we're going to add on a urinalysis, because urine can tell us so much about what's going on internally. And then if you're a senior patient coming in that's healthy, we're going to run a senior screen that's going to look at everything that we look at in a young cat, but it's also going to add on that thyroid, and it's going to add on that urine, and it's going to continue to add on the leukemia FIV heartworm test. And even if your kiddo has never gone outside since it was a baby or since you adopted it, any sick cat should always have a leukemia FIV heartworm test, because both leukemia and FIV are viruses, and if they're sick, a virus can become active in the body, and we always want to double check and make sure that we don't have either of those affecting our pet's health.
Well, what should I do if I have questions about cat lab work, or I decide that I want to run lab work on my cat? What should I do?
If you have questions about it, I want you to call us. My staff is absolutely phenomenal at helping you understand what it is that we're recommending, what it is that we're running. We also can provide you a treatment plan so that you know what the cost is going in. And then if you know you want to run lab work or blood work on your kiddo, then you just let us know when you come in for your annual panel or your annual preventative care. We're always going to recommend it. Does not mean that you have to do it, and that is okay. But if you know you want to do it, you just say yes when our wonderful assistants ask you if you'd like to run preventative blood work or a preventative panel on your kiddo.
Awesome. And what number should I call if I want to make an appointment?
If you want to make an appointment, call us at 513-563-0410.
Thanks, Dr. Goodman.
You're welcome. Let us know if you need anything. Thanks.